Hi, everybody. Welcome to the American Sleep Apnea Association Webinar Wednesday. Today, we're so happy that we have Dr. Daniel Hernandez, who is the Medical Advocacy Liaison for the Global Healthy Living Foundation. And he is based in New York City. In addition to his medical responsibilities, he leads Hispanic outreach across all disease states. He's the co-founding chair and current advisor to the International Medical Graduate Section of the National Hispanic Medical Association. Dr. Hernandez was born in El Paso, Texas, and he graduated with a biology degree from University of Texas at San Antonio and a medical school graduate of the University of Guadalajara. Welcome. We're so glad to have you here today, Dr. Hernandez. And my co-webinar friend here is Justine, and she's going to be talking with us also today. So welcome.
Thank you very much, Teresa. And I'm so happy to be part of this webinar, and I'm very excited to share a bit of our data and just to have a conversation about, I think, a very important topic, which is pain and sleep.
Great. We're so happy to have you here with us. Okay, I'm going to move to the next slide. And there's Dr. Hernandez.
As Teresa said, my name is Dr. Daniel Hernandez. I'm the Medical Advocacy Liaison for Global Healthy Living Foundation. And today we're going to talk about pain and sleep and how they're correlated, especially in chronic diseases. We'll talk a bit more about the importance of having an open dialogue with your healthcare provider and going in with a plan to these visits. We can go on to the next slide.
Okay. I see here, Dr. Hernandez, it says that you were diagnosed with sleep apnea in 2005. Since we are the American Sleep Apnea Association, can you tell our community a little bit about your diagnosis?
Absolutely. Yes, unfortunately, I was diagnosed. Unfortunately, I was diagnosed in 2005. So I was 17 years old at the time. I say fortunately because up until that point, I was chronically tired and I didn't know why. So I come from a household that everybody snores. I'm pretty sure my mom's going to kill me now because I just told the whole world that she snores. But so it is a genetic condition, having a sleep apnea in the family, but nobody was aware of what it actually was. And I found out through chance. I was reading about sleep apnea and decided to learn a little bit more about it. I spoke to my doctor about it, and he referred me to a sleep clinic. I went to that sleep clinic, and the results were alarming in that I was basically waking up the entire night gasping for air, and I went to an ENT, which is an ear, nose, throat doctor, a specialist, to see if I could have an operation to help alleviate the sleep apnea. Unfortunately, I was not a candidate, so I have been treating my sleep apnea with a CPAP machine, which is a continuous positive air pressure machine. I'm now on my second machine, and I'm very happy that I was diagnosed when I was diagnosed. I don't think I would have been able to navigate college or even medical school if I would have. I wouldn't have been diagnosed when I was. So yeah, that's a little bit about my journey to being diagnosed with sleep apnea and treating it.
Great. Well, we're happy to hear that you were able to get diagnosed. And, get on your treatment at such a young age, because that's one of the things that our association is trying to raise awareness for, is that it's not necessarily an older person, an older male's condition. It does affect women and adolescents just as frequently. So we're happy to hear that you're on that care. Great.
Yes, thank you. Yeah, I'm very, very happy to have been diagnosed when I was. Just a quick overview of what we are going to be talking about today. We'll start off just having a quick recap of what sleep is, how we define it, and we'll go on to studies about sleep, pain, and fatigue. And then we'll focus on what you can do about it. And at the end of this presentation, I'd love to take any questions that you might have. Can we go on to the next slide?
Yes.
Okay. So before we begin, I'd just like to give you a little bit more of a view of where I work and what I do. I'm part of the Global Healthy Living Foundation. This is a nonprofit organization whose mission it is to improve the quality of life for people living with chronic illnesses by advocating for improved access to healthcare at the community, state, and federal levels, and amplifying education and awareness efforts within its social media framework. So under GHLF, we have 3 organizations. We have Creaky Joints, which is our chronic illness online community, Arthritis Power, which is our research app and analysis branch, and the 50 State Network, which is our patient advocacy branch. We'll be speaking a little bit more about Arthritis Power and the 50 State Network today. Could we go on to the next slide, please? Thank you. Okay, so before we start talking about pain and sleep, I'd like to go into what is the quote-unquote perfect sleep. Perfect is in quotations because in reality, there really isn't a one-size-fits-all sleep cycle for everyone, as these cycles tend to change with age and other factors such as the medications you're taking. What we can do is we can use this graph as a way of gauging how we are doing in our own sleep, where ideally we would have about 5% of the night a light sleep, which is stage 1. 45% of the night would be a slowing down of the eye movements while our brain waves also slow down, which is stage 2. 25% of the night would be with delta waves, which is a very deep sleep, which is stage 3. And this is also where it's theorized your body repairs and regrows tissues, builds bone and muscle, and strengthens the immune system. So it's a very important part of your sleep cycle. And 25% of the night we would have REM, which is rapid eye movement, and it's usually where we dream. Usually this sleep cycle lasts for about 90 minutes, and ideally we would have about 5 sleep cycles in a night. But in reality, sleep is ideal for you if you can be rested throughout the day and not feel like you need more of it. Something that anybody having untreated sleep apnea or any other sleep disorder knows how it feels to consistently need more sleep. Can we go on to the next slide?
Yeah. And I was also just going to add that, obviously with our topic today, if your sleep is consistently interrupted by the pain that you're feeling in your body, that's the other thing too.
Right.
Having restful, complete sleep cycles, and then it's then affecting a myriad of other issues. You mentioned, I think you said it was in stage 3, repairing of your body, your immune system, and so trying to strike that balance to get the sleep that you need is hopefully going to help your pain. It's kind of a little bit of that chicken and the egg, the circle that has no beginning and no end.
Right, absolutely. I think spoiler alert. That's a little bit of what we're going to talk about today, but it is a sort of it's so they're related so well with one another that if you do not treat one, the other will be affected. So if pain is not treated, obviously sleep will be affected, and it's a vice versa effect as well.
Okay.
All right. So I want to talk about the data we gathered from our app, Arthritis Power, which can be downloaded in your app store. And also, I want to talk about the importance of tracking your symptoms. What this app does is it helps patients track their inflammatory autoimmune diseases, and also uses the data to conduct and publish many studies through a process called PROMIS. This means patient-reported outcomes measurement information system. It's a mouthful, but what this process lets us create is scientific studies with the help of our Arthritis Power users, and we publish the findings to create more awareness about these diseases and how they affect us in an everyday basis. We'll talk about the data that we've collected so far, and so our app is, as I mentioned, for inflammatory autoimmune diseases. Now, if you do not have an autoimmune disease, it's important to also track this type of data. And the way that you can do it is the American Sleep Apnea Association has an app as well. It's called Sleep Health. It's available on Apple products. Is that correct?
That's correct. Yep, on the Apple Store, iTunes Store. Yep, you can download it to your phone, and like you're saying, it is a self-reported application where you can track your sleep and make other notes and answer other questions about how it is you're feeling and what has interacted with your sleep. You had talked about this network being for those with autoinflammatory conditions. Can you kind of maybe give some terms of more layman's terms of what that is and who those people are? I mean, obviously,
absolutely.
That's the name of the app. I figured that one out.
Right. So the chronic autoimmune inflammatory disorders encompass a myriad of diseases. So it's basically these cause an abnormally low activity or overactivity of the immune system. And in cases of immune system overactivity, the body attacks and damages its own tissues. So the diseases that fall under this is obviously arthritis, rheumatoid arthritis, ankylosing spondylitis. Systemic lupus erythematosus is also part of this. Inflammatory bowel diseases are also part of this. The most, the biggest ones are Crohn's disease and ulcerative colitis.
Mm-hmm.
Multiple sclerosis also falls into this, and Guillain-Barré syndrome, as well as many other diseases such as gout and other inflammatory diseases that are caused specifically by problems with your immune system. So
great. Okay, great.
So going on to the next slide, please. Okay. So from the database, we analyzed data focused on pain, sleep, and fatigue, and whether we were able to see a correlation. This is important to sleep apnea patients because usually sleep apnea is a comorbid disease, meaning it comes accompanied by different diseases. The biggest ones associated with sleep apnea are hypertension, obesity, depression, GERD, which is gastroesophageal reflux disease, as well as others. So understanding the relationship between sleep, pain, and fatigue is important to help patients such as yourselves be aware and treat these in order to try to prevent the increase of other chronic diseases. So what we found were some surprising and other not so surprising correlations, but what is important is the relationship with one another. The first thing that we did was analyze pain and how it interfered with the daily life of patients with chronic diseases. These were our results. To put this into context, into context, the PROMIS score of 50 is right in the middle and normal. And since the people that use our app use it to track their symptoms with different inflammatory, autoimmune, chronic diseases, it was to be expected that they felt more pain than the average healthy person, but this was an extreme. Could we go on to the next slide, please? So what we found is only about 20% of the general population has a score worse than 60. And this meant that 50% of those with chronic disease using our app experienced pain worse than approximately 80 to 99% of the general population, which is a very, very large population of these patients that are experiencing pain.
Right.
Can we go on to the next slide, please? Oh, yes. Justine, do you have a question? Okay.
Oh, yeah, I was just agreeing. So, here's the next slide.
Okay, thanks. So these are the scores for sleep disturbance and fatigue. We found that both were also higher for patients with chronic diseases using our app. But what does this mean? So if we can go on to the next slide, please. What this means is that chronic disease patients experience higher pain, sleep disturbance, and fatigue compared to the general population. Now, you might be saying that this is obvious and you didn't need a webinar to tell you this, but here's what's important. Could we go on to the next slide, please?
Mm-hmm.
Thank you. The correlation between pain, sleep scores, and fatigue were statistically significant, meaning that they are all interlinked. So as Justine was saying, it's like the chicken and the egg. We really don't know which one starts first, and obviously it's not that important since we do know this correlation. We have to make sure that we're treating everything in order to avoid one from exacerbating because of the other. So if one is affected, chances are the rest will be as well. And this is why it's very important to treat sleep apnea, because you want to avoid other symptoms or of comorbidities that you might be diagnosed with. Now, to be a proactive patient when going to a healthcare professional, you might want to be prepared to express any type of symptoms you might be feeling, and pain is one that is usually not communicated as properly as it should be, and that's what we're going to talk a little bit about next. Could you click on the next slide? Thank you. So now that we've established the importance of sleep pain and fatigue to treatment and avoiding an exacerbation of our current illnesses and others, I'd like to spend some time highlighting the importance of keeping a log of your symptoms, such as sleeping habits, and if you are experiencing pain, it's important to log them in a way that the healthcare professional can easily document and analyze to diagnose and treat as efficient as possible. Here's what's most helpful. So if you keep a log of how long you've had your pain, where you feel the pain, whether your pain is in one spot or spread out, or if it starts in one spot and does spread out, how the pain feels and how severe it is. Usually you can answer this severity by giving it a scale. So you can either do 0 to 5 or 0 to 10, 0 being no pain and 10 or 5 being the most excruciating pain. Mm-hmm. That's also very important to communicate with your healthcare professional.
That makes me think of those little faces in the doctor's office. The little starts off with the green kind of smiley face and then moves all the way over to the red face, where it's the most pain you've ever felt. Yeah.
Absolutely. Yeah. This is other than it being very important for doctors to document this for insurance purposes, it's very important. If you can come into your doctor or your primary care physician or your healthcare professional that's treating you with this type of information, it will expedite everything, and it will make the process of your diagnosis and your treatment much, much easier because you are a prepared patient. Other things that you'd like to, that it would be important for you to log is whether pain is constant or comes and goes, what activities make pain worse or improve it, how your pain limits what you can do. Just going up to that, what activities make pain worse or improve it. Also, it's important to, if you're taking a medication and that medication helps, or that medication is making your pain worse, that's also a very, very important thing that you should log and let your healthcare professional know, and as well as anything that triggers a pain other than medications. We can go on to the next slide. Okay, and another thing that is very important is being aware of the terminology so that you can use it in your doctor's office or in your healthcare professional's office in order to have a much clearer and a better informed dialogue between you and this person that's helping you to treat this type of pain. So I'd like to kind of go over the definition of pain, as well as give you a few adjectives that you can use in these logs in order to try to create the best and biggest picture for your doctor, your healthcare professional to help you diagnose this with. So acute pain, it usually comes on suddenly and has a limited duration. So it's not, it doesn't happen continuously. It's frequently caused by damage to tissue such as bone, muscle, or organs. And chronic pain, it lasts longer than acute pain, obviously, and is generally someone resistant to medical treatment. So usually an over-the-counter pain pill, if you take it once, it's not going to treat it, usually. Frequently, it's attributable to nerve damage, and nerve damage is also something that is very important to find as many adjectives to describe it as possible, so that the healthcare professional can diagnose this as nerve damage. A lot of the times it's a burning sensation, but there are other ways to describe it. And it's also usually associated with chronic diseases such as the ones that I had previously mentioned, rheumatoid arthritis, ankylosing spondylitis, gout, and so on. Can we go on to the next slide, please? Thank you. Okay, so here are examples of different adjectives you can use to describe your pain. These aren't the ones that you have to use, but it's just a nice little list in order for you to have a guide. And whenever you're at a loss for words, you can look at it, and if one of these you can relate to in your pain, then it's important for you to write down and let your doctor know, or your healthcare professional know. Such as throbbing, shooting, stabbing pain, sharp pain. As I was mentioning, hot burning pain sometimes is associated with nerve pain. Aching, heavy, tender pain, splitting pain. So here's an interesting one. This is from a McGill pain questionnaire, so this is what's taught in medical schools. But fearful pain. So this
I
is
thought
also
that one was very interesting. I never
right.
thought about using that descriptive or even heavy.
Yeah.
But maybe that's good. You know, I've been fortunate enough not to experience something that feels heavy, but the fearful one, that's kind of stuck out to me.
Yeah, no, absolutely. I mean, I hope that nobody experiences this type of pain or has to use these types of adjectives, but it's important to know that they're available for you if you do feel something that's representative of a fearful pain. You can express these types of you can use these words to express your pain to these primary care physicians or healthcare providers, in order for them to also, this gives them a sort of urgency when you go to the office and you're able to describe your pain in a way that you're actually painting a picture. They can empathize, and they can start creating a plan of treatment as soon as possible, depending on how you're feeling. Okay, so can we go on to the next slide, please?
Could I interrupt for just 1 second, Dr. Hernandez? I would like to
Absolutely.
ask our audience that is listening on Facebook or watching us on Facebook, keep putting those questions in just like you are, and we will share those with Dr. Hernandez here shortly. Those of you who are attending in the Zoom platform and may have raised your hand, if you have a question, go ahead and start putting it in the chat box, if you would, so that when Doctor is finished, we can get those questions answered. Thank you. Sorry.
No, yeah, I'd love to hear from everybody that's listening in, and I'd love to have a further discussion with everybody about this. Could we go on to the next slide? Thank you. So, speaking about the Arthritis Power App that we have, I'd just like to share a little bit about the different partners that we've partnered with to create these types of research projects. Notable ones are obviously Harvard Medical School, Duke Medicine, Johns Hopkins, Yale University, as well as many others. And we're very fortunate to have these types of partners and gather this data and create meaningful research papers in order to understand the patient's journey with these diseases and try to put it in the right hands in order to help them as much as possible. What I would love to do is extend an invitation to anybody that has been diagnosed with a chronic autoimmune inflammatory disease to download our app and join us in other than logging your symptoms, also being part of this community.
Yeah.
Justine, you were going to say something. I'm sorry.
Yeah, I was just going to say, and you know, we touched on this before with the American Sleep Apnea Association having our Sleep Health app. It is a mobile, self-reporting sleep study. So, you know, if you're with us today and, you know, maybe you don't have the conditions that would make you eligible for the Arthritis Power, there's still a way for you to track and communicate and keep an eye on your sleep and your pain and whatever it is going on health-wise using that application. So, you know, there are definitely tools out there for, you know, for our communities to you know, help you communicate with your doctor better, for you to provide information to researchers and institutions to help them get people like you in your, you know, in your particular medical condition better care. That's the whole point.
Absolutely. Okay, and this is just how the Arthritis Power app looks. You can track your symptoms, analyze, share it with your family, your healthcare professionals, and caregivers. You can also log in all of your medications, and through these different types of partnerships that I had previously mentioned, we have the opportunity to also offer some paid surveys and studies, and you can also be part of that once in the app, as well as many unpaid surveys that help us create this this database. That's very important, and also education, which is I think the most important. Being as educated as possible in your disease, and having as many tools to manage this disease that you're facing. It doesn't matter what it is, if it's sleep apnea, arthritis, gout, or any other illness. It's very important to be as educated as possible so that you can be as proactive of a patient as possible. Can we go on to the next slide, please? Thank you. And finally, this is just a quick public service announcement that I'd love to get everybody with. I know that it's very important to be diagnosed and go to your doctor regularly, but sometimes it's very difficult, especially if you do not have insurance. Open enrollment has not ended. It differs between state to state, and we've created a guide on our 50-state network. If you just go to 50statenetwork.org, you'll be able to click and find the health insurance guide, or that is the direct link to our insurance guide. And we give information not only on open enrollments, but also on employer-based enrollment and on Medicare. So please visit that. And if you have any questions, if Justine, you could click on to the next slide, please. Thank you. That is my email address. I'd love to connect with you. Please send me an email on comments or questions, and I'd love to help you out. And if I can't, I'd love to redirect you to somebody who can. And I really appreciate the American Sleep Apnea Association for having me, and I'm open for comments or questions.
Okay. Well, we have a first question here from Lois, and she says, why isn't fibromyalgia included? What is the name of the app? I have pain due to severe spinal injury, fibromyalgia, lupus, severe neuropathy of many types, which is worsening, and have no feeling in my hands or feet now, and soon will have no feeling at all. Syncope usually at level 9 on pain meds. When I was diagnosed with sleep apnea, I was having 60 to 100 events per hour. We tried all the machines, and now am on the ABS machine, and my events are way down. Would I be a candidate for that app, she says.
Lois,
so I'm very...
Questions. Yes. I think the first and most important one is that fibromyalgia does fall into this category. The app is called Arthritis Power. You can find it on your Android or your Apple App Store. So you would be absolutely a candidate for this. I'm very sorry that you're experiencing this type of pain. I'm happy that your sleep apnea has been controlled, but I would love to have you log into our Arthritis Power, and also if you can send me an email, and I'd love to connect with you on a personal basis and try to help you out as much as I can.
Okay. I am trying to locate another question here for you. Are there some in the... Oh, here we go. I just wanted to say, sometimes people who have chronic pain may have a different scale than those on the smiley face scale. Their 1 may be someone else's 5. What about fibromyalgia on alpha sleep, meaning stage 1?
Yeah. So for the smiley scale, unfortunately there isn't a better way of informing your healthcare professional about how you're feeling. I understand that sometimes 5 doesn't express the pain that you're in, especially when you have something such as fibromyalgia. It's just it. So that's why I gave the examples of adjectives. It's very important not only just to give a pain scale, but also try to paint as vivid as a picture as possible to your healthcare provider, so that they can understand as much as possible how you're feeling at that moment or whenever you're feeling like that. And that's why it's also important to log these symptoms as you're feeling them.
I think too that, you know, if that the physician will be able to see if you log things and are able to communicate that detailed information, that when you say 5, and that means you can't even go outside to get the mail, that's how bad you feel. But then when another patient says 5, they can take the dog for a walk, they're able to, you know, look at your history and be able to make a determination. Because I understand, everybody, you know, I don't think the food is spicy, but you think it's really spicy. And so everybody has a different tolerance for those things, and you know, has their own opinions on it. But I think, as you're describing, Dr. Hernandez, if you have that detailed and kind of, you know, over a period of time as well, you know, maybe it's, you know, it can't just be a week, it needs to be a little longer, it needs to be a month, it needs to be 6 weeks, to be able to fully give them enough data to have a clear understanding.
Absolutely, yes. And it's also very helpful, not just for you and for the healthcare provider, so that whenever they do issue a medication, you can see how well it's doing, or if it's not doing what it's supposed to, and the physician can also, or the healthcare provider can also see this, and they can adjust accordingly. So it's a very, very important tool that everybody should be using, which is logging your symptoms.
We have a couple of more questions here. This is from Matt on our Facebook channel. Watching live on my phone, I've had central sleep apnea and have been on the same pain medication since 2011. The only thing that has changed is my sleep. And then it says, it gave me brain damage and has taken me about 1 year to reverse heal. So he's just making a statement there. That's not a question, but thank you for sharing, Matt.
Yeah, thank you, Matt.
I have positional sleep apnea only when I sleep on my back. What research has been or is being done for positional sleep apnea? CPAP did not help me at all. Karen, if you would like, I will send you some research when the recording has loaded up here for this webinar. So it might take a couple of hours, but I will get it to you on this link where you asked. And we have Kyle from Alberta, Canada, saying hello, a fellow respiratory therapist. Hello, Kyle.
Hey, Kyle.
And Kevin is listening from Canada as well. That's our Kevin Bradley. Kevin Bradley, who does Facebook Live for us every month. And I have no more questions that I see. I'm going to look over in the Zoom platform and see if anything. Let's see. I think we answered that. Oh, Janet has a question. Why is there such hesitancy for sleep doctors, such as pulmonary, to switch a patient from CPAP to BiPAP when CPAP cannot be tolerated? I struggled personally for 5 years on and off with CPAP I could not use. And then finally, well, you know, that question can't really be answered except that, you know, we don't know why you were on it like that for that long, but BiPAP certainly gives you that pressure relief feeling on your exhalation. So, yes, you will get your pressure on your inhalation of CPAP, but on your exhalation, your pressure will go lower. So we used to tell people, oh, it's like sticking your head out of the window when the car is going at 60 miles an hour. You know, it's hard to breathe against that. But BiPAP is beautiful for that. I hope that answered your question, Jenna.
I wanted to ask you a question. Can you offer any advice or guidance to people listening about talking to their doctor about pain, prescriptions and medications and their sleep? You know, because there's different types of, granted, again, here I'm not a medical person, but there are different types of pain medication, things that, you know, numb, I guess, your system, and other things that relax your muscles, you know, to offer comfort for the pain that the patient is feeling. You know, are there conversations that, you know, people that are having sleep issues should talk to their doctor about when being prescribed or taking these medicines?
That is a very good question. I think that falls back into our message of being as communicative as possible with your doctor. I understand that many times you see your doctor for 10 minutes or sometimes even less, so it's not that, it's easier said than done, but it is very important. That's why you should have a log of the symptoms you're feeling if you haven't been diagnosed with sleep apnea, or if you are diagnosed with sleep apnea, or you have any other type of sleep disorder or a pulmonary disorder that might affect your breathing, and the doctor doesn't know this. He might or she might give you a medication that might put this might make your other diseases worse. So I think it's very, very important to be as clear and as have that log with you whenever you do go to your healthcare provider, so that they know exactly what's going on and what medications they have to avoid, so that it doesn't exacerbate the diseases that you've previously had.
And maybe there's some people here that maybe, you know, necessarily haven't been diagnosed with OSA, or, you know, but you know, their bed partner or someone in their family tells them that they are a snorer, which, you know, from the ASAA perspective, we would encourage you to talk to your physician about that, because that is definitely one of the precursor easy signs that you may have some sort of sleep disturbed breathing occurring, as just generally snoring. But maybe even just to bring that up, if you see like some sort of pain specialist or some other doctor in regards to your autoinflammatory disease, because I think that would be important for them to know, because that's how you're breathing when you're sleeping, and that might, like you said, change the type of direction that they go in to assist you with your pain.
Absolutely.
I had one more question. Let me see if I can get back there. Okay. Do you have recommendations? This is from an anonymous attendee. Do you have recommendations for managing sleep and pain while keeping a primary focus on work or study? It's one thing to optimize CPAP, sleep hygiene, medications when solely focused on existing as a patient. It's another when one has to prioritize other aspects of their life. Part of the question is the realization of having many setbacks and then having to returning to baseline over and over again.
That's a great question, and unfortunately, I really don't have a clear answer for that. It is time consuming, I understand, and it is something that, as patients, it does take you from your more daily activities, so that you could focus on this specific disease that you might be having. I think it's important to form a habit, and as I said, try to log as much as possible with the time that you do have, and just try to fit it in your schedule as much as possible, because it is something that it will help you in the long run, and it will improve your quality of life, and that's what we're all striving for, So
right.
I think that's the best answer that I could give for it.
It can be very time consuming when you have a chronic condition and trying to manage all of the appointments and physicians and so forth. But I'm just tossing this idea out there. Maybe you could possibly even consider looking at other physicians or a different physician, because there definitely are doctors and healthcare providers that, branch over a little bit from one thing to another, or have a very firm understanding of, say, sleep and how it affects pain and other chronic conditions. And so, maybe you would be lucky enough to find someone where you could get 2 appointments out of 1, per se.
Right.
To try to kind of do a search on that. Dr. Hernandez, is there anything that you've talked to with your community or have advice on? We talked a little bit about getting prescription medications, for pain. Are there other types of therapies that you are familiar with that maybe we could just talk a little bit about that can help people, manage their pain and therefore their sleep? Something, I don't know, some sort of yoga or meditation or other things that are available out there that are kind of in that external therapy area.
Absolutely. So these usually are called non-pharmacological therapies, and there's a wide variety of them. And so, just like medications, these therapies aren't one size fits all. So it's one of those things that you also have to try different types of therapies and eventually find one that does work for you. There's some examples of them are the ones that you just gave, just in like yoga. There's also acupuncture and meditation, hydrotherapy, which is going into a pool and doing different exercises and trying to prevent as much strain as possible in your body. I'd invite the listeners to go to creakyjoints.org, and we have patient guidelines for different disease types, and in that guideline we have these listed, and we have examples and some data that we've collected based on how they've been helpful to other patients. But as anything else, there isn't a cookie cutter type of explanation for it. It's basically I'd encourage you to, other than your pharmacological therapy, which is very important as well, trying these different types of therapies and trying to manage your disease as much as possible.
Yeah, I think that's a good resource for, depending on what type of condition and or pain you're experiencing, head on over to that website to see those other therapies that other people obviously have had success with, and see if that might be something that can apply to you. I have a question here on Zoom from Miss Brooks. She's saying nervous about using medications because of her OSA, and she does have some pain issues. and she does feel tired in spite of consistently using her CPAP. Do you find with some of your community that the persistent tiredness maybe is associated with the pain too? Like it's not just the sleep causing it?
Right, absolutely. No, yes, they are correlated. So pain, fatigue, and sleep, they're all interlinked. So if you are having pain, more than likely your sleep will be affected, and that's why I feel like a broken record. But excuse me for it, but I just want to say it one more time because it's very important. Keeping a log is very, very important in order for you to manage this disease as best as possible.
We have one more here from Matt Gentry. No question here. I'm just trying to learn. I've been really sick and now I'm feeling great, mentally at least. I want to be prepared to battle the stigmas. CPAP stigmas versus opioid stigmas are not helpful. People are dying from central sleep apnea and something needs to change. Well, yeah. I mean, well, first of all, we're glad that you're feeling better, Matt. I don't know if you're currently on CPAP or not, but yeah, we agree.
Absolutely.
Yeah, Dr. Hernandez, we talked a little bit about this before about with the prescriptions being opioids, for chronic pain, and we had talked a little bit about keeping that as part of your log, and maybe not working with your doctor and not thinking that pill is the final option and the continued year after year option for how you're feeling.
Opioids are a tricky type of medication to talk about because there are some patients that need it, and it's a very important part of their treatment. But the managing of these diseases is you're trying to avoid getting into a cycle of having to be treated by these very, very strong medications. What you're trying to do is the final goal of treating chronic diseases is trying to treat your medication without opioids. It's easier said than done, but a very important thing that you can do is by obviously logging all of your symptoms while on opioids, after opioids, and working with your healthcare providers so that you can get off them as soon as possible.
One of the things that we've talked a little bit about and has been out there in the chronic pain arena, or I feel is, and as more and more states pass laws for either medical marijuana use or recreational use. I mean, the studies and all of the information on that as a potential option or assistance for people, it's still being done. The studies are being done, the research is being conducted. So that's a good thing for all of us to know that hopefully within the next couple of years we'll have a little bit more of a definitive answer on maybe some other therapies medicinal therapies that can help individuals.
Absolutely. We're actually looking into patients' usage of medical marijuana in Arthritis Power, and we're very interested in the results, and I would love to come back whenever we finalize this study and speak a little bit more about that.
Great.
Please do. That would be great.
Looking forward to it.
I don't have any more questions, but let me go and check.
Okay.
From the Facebook, it looks like we are caught up. Wait a minute. Oh, Kyle says, thank you, Dr. Hernandez. I will be able to better educate my sleep patients who also have chronic pain and give them a resource to plug into using the Arthritis Power App. Thank you, Kyle.
Thank you, Kyle.
Great. Well, I think we can pretty much wrap it up today with Dr. Hernandez. I know that this has been a hot topic in our community, and we've had a lot of questions about it in the past webinars and Facebook Live events that we have done. So we're very happy that you were able to be with us today and share the information and the items that you guys are working on, whether it's the information available through Creaky Joints or joining the Arthritis Power app and network, and what you're doing with Global Healthy Living. We're very excited to have you with us today.
Thank you very much. I really appreciate the invite. Thank you, Teresa, Justine, and Adam, and the American Sleep Apnea Association as a whole. I love what you guys are doing, and I'm very honored to have been invited. And I hope I get invited back soon. And have a great rest of your day.
Yeah, be careful. We're going to take you up on that offer.
Absolutely.
Well,
All
everybody, thank you. Thank you for joining us today, and we look forward to seeing you again on our either Facebook Lives or our Wednesday webinars. Thank you. Bye-bye.
Thank you.
Thank you. Bye-bye.